Appetite, or the desire for food, diminishes once food intake brings about a feeling of satiety. Let's look at how this usually takes place. Our area of focus lies within the intestinal villi. Microsomal triglyceride transfer protein, or MTP, is an enzyme that facilitates the packaging of fats into chylomicrons for absorption into the body. As part of this normal digestive process, fat enters the enterocyte. In response to the presence of fat in the enterocyte, hormones such as peptide YY, PYY, are released into the bloodstream by endocrine cells in the intestine. Circulating PYY reaches the hypothalamus in the brain. When concentrations of PYY are high enough, the satiety center in the brain signals the animal to stop eating. By targeting the MTP enzyme, Pfizer Animal Health has developed a unique treatment option for weight loss in dogs. Slentrol is the first FDA-approved weight loss medication for use in dogs. The primary action of Slentrol is to reduce food intake by decreasing appetite. Slentrol also reduces the absorption of fat. However, it is important to note that Slentrol does not affect its digestion. Here's how it works. Slentrol is an orally administered MTP inhibitor that is highly selective for the cells that line the small intestine. You will recall that MTP is an enzyme that facilitates the absorption of fat into the body. By partially inhibiting MTP, Slentrol allows a higher amount of fat to remain within the enterocyte instead of passing into the body. This additional fat trapped in the enterocyte stimulates the release of consistently higher levels of PYY and other gut hormones into the bloodstream. As the amount of PYY increases, so does the sensation of satiety, leading to a decrease in appetite and food intake. Dogs lose weight as a result of the dual mode of action of Slentrol. The suppression of appetite is believed to account for approximately 90% of the clinical efficacy of Slentrol, and the decrease in fat absorption is believed to account for about 10% of the medication's activity. In short, the dog eats less. Over time, the clinical effect of these combined mechanisms is dependable weight loss. Through highly selective MTP inhibition, Slentrol offers the promise of effective and reliable management of canine obesity. Slentrol should not be used in cats, dogs receiving long-term corticosteroid therapy, or in dogs with liver disease. The most common side effect is vomiting. In addition, dogs may experience diarrhea, lethargy, or anorexia. The client should be made aware that if any of these signs persist for more than 2 days, the dog should be reevaluated. Slentrol is not for use in humans under any circumstances.